This is the bladder, okay, and then you go to the penile area with the urethra in it, like that. These people, the bladder is on fire. It's like it can take any urine, any small urine here, even if there's tiny urine here, no, this gets stimulated, and the bladder won't empty, so it keep on contracting. You may have seen it in another form. They would say it's edge incontinence. It's the same thing. Some of these urology problems, they have the same names, but if you understand what it is, it becomes easy. So edge is different from stress. Stress incontinence is when there's too much intra-abdominal pressure and you push on the bladder and they leak. The woman will leak or the man will leak. Mostly it's the women who have this problem. Then it will leak. Edge incontinence means the bladder cannot slow down. Any little urine will make the bladder empty. And so they cannot make it to the bathroom. They're embarrassed. And so what do you think you can do for them? Pathophysiology. If your bladder is contracting too much, I will tell them slow down the bladder so that we can increase its capacity. It can take more urine, okay? Improve its ability and capacity of the urine to take more urine. It can slow down, so improve its capacity so that it can slow down. And you've heard about it. This is what we call antispasmodic medication. So anything you've heard on the, you've seen it over the counter, they sell it when you go Walmart to see them. These are what they are doing. They're telling the bladder to slow down, chill out, okay? We don't need you to be contracting too much, okay? It's fine. And they're specific, they have, you have to know them, you have to know their names, and then you heard about them before. So one of them is this. They are all, before I give you their names, guess what? Cholinergic causes the bladder to contract. So what will cause the bladder not to contract? Anticholinergic. Any medication you can think of that is anticholinergic, you can use it. Even medication for respiratory, if they get into the circulatory system, they can cause anticholinergic effect on the bladder. But these medication, I'm going to give you the specific for the bladder, but any other anticholinergic can do the same thing. So when you give it to them and they ask you a question, you should be thinking about those medications too. But this is what, if you go to Walmart, you see they always listed it as overactive bladder, edge incontinence medications. And there's few of them, and they classic. So Oxybutynin, and this is the Ditropan you heard before. Ditropan, this is what it is. And then this is what they like because they know everybody know about Ditropan. So they give you this medication. This is Detrol, Tolterodine. So Tolterodine. So they know everybody knows about it. So they always like to give you Tolterodine, which is Detrol LA. Okay, and then the third one is that when I always have problem with that one, sulfonylurea. I mean, so it's also one of those medications. You just have to memorize it and say, oh, this is for, I bet you when they give you a question, they will add this one, the anticholinergic, to the cholinergic group. And all you need to do is distinguish between the cholinergic. The cholinergic guys, the specific for bladder, they have CHOL, C-H-O-L. The rest will not have CHOL. Anything that has no CHOL is not cholinergic. So then you have to think, what kind of problem am I treating? Am I treating an edge incontinence or overactive, which is the same, or somebody who has hesitancy, basically cannot go, like BPH or something like that, or they have urinary retention. Remember, BPH is a form of urinary retention. So if somebody have urinary retention, you can give them the call to empty it out. You know, overactive bladder, usually they have edge incontinence, so you want to slow them down. So these are the three medications you should know about. But the one you've seen it before in Respiratory is those with the opium at the last name, Trospium. Okay, they also do the same thing. They are called Anticholinergic, so they will slow down the bladder. I don't even have to bother you too much about what you expect on anticholinergic. Well, I can. What is going to happen? Well, they go into urinary retention. They can go into retention. So you let them know. Make sure if they don't pee, they let you know about it. They will have constipation, okay, because you slow down the gut. Then the dry mouth, they cannot salivate, right? And then they can worsen your glaucoma. If you have glaucoma, you got to tell them about it. And because of this effect, it dilates your pupil. Basically, it's going to have drowsiness based on the central acting effect. Every anticholinergic will cause drowsiness, and then they will have heat intolerance. Okay, they have heat intolerance. So this is your SATA right there. And we can teach them. If you see any urinary retention, just let me know. Constipation, what do you tell them? Well, eat some fiber, hydrate yourself, exercise. Okay, stool softener doesn't prevent constipation. So just a fiber, hydrate yourself, and exercise. Dry mouth, what do you tell them? Take sugar-free candies. You see, this is, I've said it in my video all the time. You become natural, you know, you can say sugar-free candy or chewing gum, okay, to help with that, okay? If you have glaucoma, well, don't take it, don't. Okay, drowsiness, well, be careful, you can't drive with it, okay? Somebody have to drive you. If you have to take it, let somebody drive you. And so, and then incontinence, you can go out in the sun. You shouldn't do that. So summer vacation, you got to be careful. When you go, don't go into the sun. So avoid the sun too much, because, or any hot place, because you have heat intolerance. So you see how the teaching doesn't, you don't have to memorize it, but you're using what you know. These are the side effects of the medication, and you teach them how to prevent it. I said it all the time. Pathophysiology give you content. Content give you the ability to find signs and symptoms. Signs and symptoms is what you're going to use to educate them and teach them. And if they make a mistake, you intervene. You come in full circle. Therefore, the underlying problem of every disease process is a pathophysiology. Try to understand why people have glaucoma. If you understand it, you can treat it. Try to understand what is going on with overactive bladder. If you understand it, then if I have to treat it, I just slow down the bladder and tell the bladder to keep quiet. Slow down. I don't need you to be all ramp up, okay, so that I can do my job. Now, what are they teaching? To prevent this, people who already have this, and you want to teach them to improve it before even you give them medication, well, decrease the risk factor of that. You already have edge incontinence, okay? Don't drink any irritant, bladder irritant, I call it. Let me use the another word, bladder irritant. Avoid it completely. And there's some things in your body we do. Most body system, there's few of them. You always see them. Alcohol, smoking, they are always there. And you can tell that something is wrong. And caffeine, okay, coffee. Something is, why is this group, every disease process they there? Because they're irritant. They just basically make things go faster. If you take them, you have diarrhea, you drink, and your bladder doesn't like them. So avoid all these irritant, alcohol, smoking, and caffeine. Okay. And then you got to let them improve their pelvic floor exercise. So they do like Kegel exercise so that they can hold a little bit better. Okay. And you can teach them to void every 2 hours. Okay. Void every 2 hours. then that will prevent them from having any bladder, because the bladder doesn't want to hold anything in his cavity anymore, because when small urine goes there, it makes his bladder go into spasm, and then you have an accident. So learn how to void every 2 hours. Do a pelvic floor exercise to improve your muscle and avoid any irritant that will make you sick. Some fruits can do that. I know some fruit juices, when you drink, it make you bad. So I think yes, citrus fruits, just avoid them. Yeah, some of them have irritant in them, and they make you really go. Okay, so this is everything I can think of that they can ask you.